If polished public relations and pre-scripted sound bites could cure a crisis, Iowa would have the gold standard of children's mental health care. And for nearly a decade, we've listened as Governor Reynolds has looked into the cameras and promised that our most vulnerable kids are at the forefront of her administration. But out here in the real world, the numbers tell a terrifyingly different story. Let's take a look at a timeline that she probably doesn't want you to see.
Mental health has been and will continue to be at the forefront of my administration.
Hmm. Okay, well, I mean, we kicked things off in 2018. Mental health is at the forefront of her administration. Classic. It's got warmth, it's got optimism, absolutely zero follow through, but hey, it's the political equivalent of telling your wife you're about to clean the garage while you're actively opening a bag of potato chips on the couch.
Adding mental health needs. We're not as far along. That's not for a lack of talking and working on it. We've been doing that
Hmm.
for more than 20 years. It's time to move past the talking phase.
Oh, okay. So, we're not as far along. Did you catch that? She literally stood in front of the entire state and said, "Hey, we've been talking about this for 20 years, so it's time to move past that talking phase." I mean, give her points for honesty, folks. She openly admitted that the government spent 2 decades admiring the problem while our children's support systems were crumbling, and they did nothing but talk. That isn't a strategy. It's an active confession of executive ineptitude.
We don't have a children's mental health system right now. We've been talking about it for decades. As governor of the state of Iowa, I will continue to work on improving that. The bill that I'll be signing this afternoon is life changing. It helps lift the veil of stigma associated with mental illness and replaces it with hope, healing, and comfort of community.
Records request confirms some of the allegations filed in a recent lawsuit by 6 former Glenwood employees. An email from May 2018 shows former Mental Health and Disability Services Administrator Rick Schultz giving permission to buy software to be used to capture and analyze data gathered in planned sexual arousal studies. Schultz wrote, quote, "Yes, I approve. Please keep the justification and my approval should questions arise later," end quote. The PowerPoint revealed by our request shows the study planned to research decreasing arousal and impulsive behavior. Now, this study
Not until we got the letter. Earlier, I learned no complaints have been filed with our office and learned a lawsuit.
Okay. So, she signs a historic life changing bill in 2019 to replace stigma with hope and healing. Beautiful. Cut to less than a year later, and the federal government has to step in because a state run care facility was caught performing bizarre, unconsented human experiments on patients with severe intellectual disabilities. And what was the governor's response when cornered by the press? Well, we didn't know until we got the letter. Think about the level of management there. The people running her agencies are treating a state-funded care center like a mad scientist basement, and the chief executive of Iowa claims she found out at the exact same time as the person reading the morning paper. Can we say asleep at the wheel?
Biden of 2020 accused staff at Glenwood of conducting human sexual experiments. It prompted federal officials
She didn't know about it.
investigating. And last year, a report from the U.S. Justice Department accused the Department of Human Services of violating the Americans with Disabilities Act.
Oh, they would never do that. Well, except then and other times.
And many are still stuck in institutions.
And those investigations.
The state-run Glenwood Resource Center is being fined for a resident's death. State inspectors say a 30-year-old died of acute dehydration after facility staff failed to monitor his fluid intake. Now, state records show the resident who died had an intellectual disability and cerebral palsy.
Iowa ranks near the bottom, 41st in the nation for the number of kids who suffered from depression last year. Advocacy groups say the low ranking is in part because of the services Iowa Medicaid isn't providing.
Fast forward to 2023. We rank 41st for childhood depression because our privatized Medicaid system won't pay for the care. So what does Kim Reynolds do? Well, I guess you'll see in 2024, she looks straight into a camera and tells us her agency is just working diligently to take a look at the system. Diligently. So we've gone from the forefront in 2018 to diligently looking in 2024. So at this rate, her administration will identify where the bathrooms are in the HHS building by maybe the time she leaves office. Not sure on that one.
This case, big picture, is about the state's responsibility to provide these legally required services, our plaintiff children's rights under the Federal Medicaid Act, under the Americans with Disabilities Act, and under the Rehabilitation Act to those services.
Oh, yeah, they're suing the state because the state wasn't doing a job, yeah. Wonder, that's why the state settled, isn't it? There it is.
With serious mental and behavioral needs. The lawsuit called the state's mental health system.
Now, do you settle when you don't have to? Or is that only when you're in the wrong?
For decades. But leaders with Iowa's health agency say they'll take steps to develop home and community.
They'll take steps.
Services for children
Steps.
with severe mental and behavioral needs. It's part of an agreement with civil rights groups that filed a lawsuit. They claim the state failed to provide proper mental
But
health
wait for this. This is awesome.
Court documents say Iowa Health and Human Services will improve care.
They will. But no concrete details. We don't know how. Oh, she's working hard again.
And this agency is
Just like in 2018.
take a
It's
look
crazy.
at the system as it exists today and to streamline and make. I have nothing to lose. And I am just trying to get.
Hey, it's like most parents that deal with the system.
Foster care in Iowa has dropped in recent years.
Oh, that's why.
More families are stepping up to keep relatives out of the system.
Hold on, I'm going to translate that for you. They push and pressure families to step up and take in foster kids. And in some cases, that's great and wonderful. In many cases, though, we have elderly grandparents who are now having to try to raise children with significant trauma-based behaviors where they're lashing out violently and they're ill-equipped to deal with it. But hey, we're doing good things, right?
And despite fewer kids in Iowa's foster care system, the need for more foster families remains critical.
I've been doing this for a very long time, and there has always been a gap between the numbers of kids who need
True.
homes and the number of available homes.
Now, earlier this year, Forum said Iowa needs more than 1,200 new foster families over the next year to address that gap. If you find out
A bill that could lock Iowa into its current privatized Medicaid system is now moving forward. A House subcommittee advanced Senate File 2422. This bill would limit our state's ability to expand Medicaid or roll back the private managed care system.
All right. So they need more foster parents. But they're not going to actually give them the support they need. They are, and oh gosh, this is the punchline right here. The darkest joke of them all. After nearly a decade of families begging for help, after ranking near the absolute bottom of the country, and after being sued by disability rights groups, and having a federal settlement because we're so inept, what is the grand executive plan in 2026? Hey, let's try to pass a bill that will permanently lock us into the exact same privatized corporate insurance loop that caused this bottleneck in the first place. Oh geez, it's pure madness. They are trying to legally cement their own failures so they don't have to answer for them. We've got to stop letting press releases stand in for performance. Please head over to Let's Talk Iowa. Look around, gather information, listen to the podcasts, and bring the truth out. Otherwise, we're going to be stuck, well, just like we were in 2018 with promises. And then through the years, more promises. And then catastrophic failure. And that will continue to be our story.
Families and advocates told lawmakers the current system could make it harder for children with disabilities to get the care that they need.
Do not like this state into a system that, frankly, in my opinion and our experience, has been pretty much a disaster from the
Yes, ma'am. Yes, ma'am. Listen, hit subscribe, share this mashup, and let's just keep tearing down the fortress. Real talk, real people, real policy.